is that I seen in what I'm about to talk about in a second, you got white doctors trying to educate themselves about African American shit that they have no clue about. So of course they're gonna say she's lying or this never happened because they've never had to deal with that. You know what I'm saying? Personally. So they have no idea. You know what I'm saying?
Yeah.
Like, in my case, when we had second daughter out there in I forgot what hospital, but we had her. We got a chance to take her home. Everything was straight. And then like about 4 or 5 months passed. We get a letter saying they need to check her hemoglobin levels, like her check her blood. And we're like, what the fuck? Okay. But make a long story short, my second daughter was born with the sickle cell disease, but not the I think anemia is what everybody associates that with, but it's another, there's several other variants out there that are not like non it's non-deadly. You know what I'm saying? So, but she was born with that, and we had no idea because we as a people, my own mama, I hate to put her out there like this, she swore up and down like you ain't got the sickle cell trait, you ain't got it, you ain't got it, blah 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 blah. But the whole time I had to have had some kind of percentage in my system to pass it on to my child. So it's crazy. We need to educate ourselves about that too, because when fast forward again, when she did have like these episodes where she would just her body would just feel a certain way, and we there's nothing we can do for her. What the hell?
Oh, you good, brother? Keep going.
Oh, okay. It was just certain episodes, and it was nothing that we can do for her. So that that fucks with you when you staring at your child and you know there's nothing you can do but take her to the hospital. So she was at Children's Hospital, and they had some kind of protocol where children with sickle cell have to stay there for 48 hours, and that kind of fucks up like your day to day. Like you want to take care of your child, but you got to tell your child like you got to be at the hospital for 2 days. So it was a lot, man, and dealing with
Definitely.
Children's Hospital, and I understand wholeheartedly where she coming from because none of the people that we was dealing with was black, and they telling us about sickle cell,
Mm.
and it's crazy, bro.
Yeah,
It's
it's
like
usually none of
we
the
should have a
doctors, none of the
section of
nurses.
some. We should have some kind of section or some kind of something dedicated for us in the hospital for that kind of shit because y'all don't know nothing about this. My daughter wakes up and she's in pain. There's nothing we can do. She's talking about her arm hurting. It feel like it's on fire. So it's like, bruh. And then you
Mm.
just holding her here in this little kind of like bed, you know what I'm saying? And just pumping her with meds. But I don't know, man. It was just, I felt compelled to say this because I never spoke about this on camera. Anybody that really knows me knows that I went through that shit. But yeah, bro, it was a challenge, and I understand because we had to give her vitamin D and some kind of other medication until up until she was 5. But I read about it in this book that they gave me, and she can live a productive, healthy life. You know what I'm saying? Is she got a decent lifespan, if that makes sense. But like the sickle cell anemia is what really takes us out. You know what I'm saying? When people say they cold, they got low iron and shit like that. It's like we gotta educate ourselves about that because I didn't even know I had a trait, my nigga.
Right.
And that's something that
Right.
should be talked
And
about in like a first date kind of shit because you
but
never know what kind of complications you'll see down the line if you like this person and then want to have kids and then they're y'all stuck with this problem. You know what I'm saying? So
and I'll chime in and say, I understand where you're coming from with not knowing that there was
mm-hmm.
something different about your DNA. One of the additionally rare things about my daughter's case of Primrose syndrome is that most of the people that are diagnosed with that condition, it spontaneously occurs. We are one of very few cases where the cause of Primrose syndrome was genetically inherited. They took my DNA, and I'm missing part of my third chromosome on the ZBTB20 region as well. And I passed that genetic deletion on to her, which presents in her as Primrose syndrome. In me, the genetic deletion presents, I am a person with autism and severely dysregulated ADHD. I also have connectivity tissue disorders. That's the reason I had to get the valve repaired in my heart, because of that genetic deletion. But they don't make you take blood tests anymore to have children or get married like in the olden days. But there are benefits. There are benefits to knowing what is going on with you and what is going on with who it is that you plan to procreate with.